Well, all right. Looks like everybody's in the house. Yay. All right. So let's get this party started a little bit early to give you guys as much time as possible to address a fascinating topic and conversation. Of course, Frank Katita is back with us to moderate this panel. He's had a long afternoon. Frank, we really appreciate your time on that. And joining Frank is Shankar Samasundaram, who is the CEO and founder of Assimile, where he drives the overall vision, strategy, and core technology for the company. Prior to Assimile, he started and ran the IoT business at Symantec, growing it to 100 employees and 40 million in annual recurring revenue. He also ran corporate strategy and business development for the Veritas business unit. Prior to Symantec and building on his time at Qualcomm, he ran product management for the iPhone 3G modem at InterDigital, running layer 2 and above for licensing to Apple phones all over the world. He holds over 60 granted patents, with many more pending. Joining him is Sahan Fernando, who is a CISO at Rady Children's Hospital and Health Center, the largest children's hospital on the West Coast and one of the nation's top pediatric healthcare systems. Sahan's experience across different verticals includes security operations and engineering, incident response and IT, and information security program development. He's spoken at numerous security conferences and is a member of the Tribe of Hackers, the Blue Team, the Good Team, and serves on the board for Help ISAC, as well as advises other industry groups and government. And rounding our panel is Carter Broom, the founder and CEO of First Health Advisory. Carter brings 24 years of healthcare information technology management, consulting, and security leadership experience to the company, and as CEO draws upon his cyber health, consulting, and vendor leadership background to benefit commercial and federal clients and partners. Prior to founding First Health, he was a director of business development at Park City Solutions and spent 5 years as an applications and integrations program manager and consultant in the health IT arena with First Choice Consulting. All right, I am going to turn this fascinating conversation and our last big panel of the day over to you, and we'll see you at the end.
Thank you again, and thank you to the 200 and some people that are watching live for the resilience of watching me for 3 sessions today. So I appreciate their endurance, and hope we can keep it lively as we get close to the close here. The purpose of the session is related to the finance issues and budgeting issues and investment issues as it relates to cybersecurity. We know that the budgets can be fleeting. Sometimes the lack of knowledge of what cybersecurity is or what it means leads to a dead end in getting the appropriate investment. So what we want to talk about here is exactly how do we build that ROI into cybersecurity investment, what some of the latest technologies are, how we're going to govern this, and much like we have in some of the other panels. Some of these things are ubiquitous in terms of what we're doing. So what I'd like to do is to start, if you could just introduce yourself, Shankar, to start, and introduce yourself in a day in the life of Shankar, and what you like to do with your free time.
Yeah, no, thanks a lot. Thanks a lot, Frank. So I'm Shankar, founder and CEO of Assimile. Line about Assimile. Assimile, our company's focus is around inventory, cybersecurity, operational management for medical and IoT devices. So solve for use cases around visibility, helping prioritize and mitigate vulnerabilities, risk modeling, pre-procurement risk, threat detection, and incident response. Really, as the company has grown, my role has changed more from being in the weeds to really helping set the strategy and vision for the company as we have grown also internationally. So there's a lot of moving parts in a company. And a lot of my time, which I really like, is spent in dealing with CISOs and CIOs, talking about how do we move the ball forward for them, right? What do we do to make their organization more secure? And how do we actually help them present in front of the board? How do we make sure that they look like they're actually doing the right stuff for the organization? And for me, that is the most interesting part about what I do, which is what we'll discuss here today. Outside of that, I mean, there's a lot of other sports I like to play, but sports is very similar to cybersecurity. Cybersecurity, it's a team play, But yeah, I think the topic that we have today is in my mind top of mind for CISOs and CIOs. Where is the budget coming from, and where does cybersecurity in healthcare fall in the list of priorities? Is what
And
I've been spending a lot of time on.
What do you think makes Assimile different?
So, I mean, there are a few areas from a technology perspective. I mean, vulnerability management has been a differentiator, getting it down to the top 1% and allowing customers to mitigate their risk without doing segmentation and when there is no patch. We do allow segmentation and micro segmentation through our portal, but if you don't have that option because it takes too much time, too much effort, it takes too long, then how can you do it with very simple targeted recommendations and then narrowing it down to the 1%? The other area is really around incident response. If you have an attack, how do you really capture data at the point of the incident without having to go, run entire sophisticated data capture? How do we do it at the point of the incident? Because an average attacker stays in the environment for only 48 hours. So how do you really capture the data for forensics for later, the raw data, I mean, not just generic metadata? And how do you then set policies that can allow you to analyze the data to understand what's happening in the environment? Then we have something that will allow you to analyze the risk for devices at procurement. I think while we talk about a lot of connected devices, new devices are constantly coming into the environment. If you actually safeguard them at procurement, you can actually save a lot of time down the line and effort down the line. So how do you really assess the risk of devices and procurement, safeguard them? And there are a couple of other areas we are working on disaster recovery and a couple of things which are coming down the line, which are going to be unique about Assembly as well.
Great. I want to come back to that moment part. Capturing it at the moment, I think, is important. Hassan, day in the life of?
Yes, very much.
What do you do with your free time? In that order.
That's pretty limited. Trying to stay busy, but I'm fortunate that Reed is very supportive of a good work-life balance. So I do also help basically as a volunteer for coaching men's rowing at the collegiate level. We get the opportunity to travel quite a bit. And then I have a Pembroke Welsh Corgi who's currently in the office because that also takes a good amount of time.
And how would you say your KPIs are measured within the organization in terms of performance? What's a big KPI indicator for you?
So it's an area that we're always looking at for constant improvement. And I think for us, we looked at it more historically in terms of what I would call reactive indicators, right? Shankar already called out vulnerability management as one of those. So for instance, you could go off of here's the number of highs and criticals or the risk score that's identified by your vulnerability scanning tool. And we're trying to really look at more of a proactive measure of risk realistically. And so looking at, what is the ongoing time to remediation, assessing ourselves against the policies and essentially the SLAs that we've set with the organization to the best of our ability. Looking at our risk register that we've established and tracking, risks that we have chosen to accept. Are those still valid? Have they expired? Are there new compensating or mitigating controls that we can have in place? Items like that. How do we track, really the things that would get abused from a threat standpoint for, things like privileged access? So I also tend to look at the technical. It's easy for me to get caught up in there. And so I also like to look at things like what is the percentage of assets that are in alignment with our security standards, right? Are they all up and running on whatever is required for endpoints, whether that's EDR, are they running their daily scans? Just some of those basic controls in place. That's a strong validation. But then we also want to look at, from a resiliency standpoint, are we keeping up on running our annual tabletop drills? Are we doing kind of security awareness training? Not tracking the click rate so much. While that's important, we look at that as, again, not so much a leading indicator, but areas for improvement. And then are we doing our BCP-DR tests? Are our backups all running on a regular cadence? Things like that are where we're trying to shift towards and make sure that we're able to get that telemetry and hold ourselves accountable. Because ultimately, for us as a covered entity, it is going back to how do we ensure that there's resiliency in our ability to provide care.
That's great. That's great. So we wanted to make sure that we had a sort of the finance and economics lens that we're looking through. So we're thrilled to have Carter on the panel today. Carter, I think I've been together a number of times. I know what the day in the life of is for you. It's crazy. But could you tell our audience what you're up to there at First Health and then what you like to do in your free time?
Absolutely. And Frank, let me say thank you for hosting this event. You're doing a great job, and I'm really appreciative to be on with Sahan and Shankar, two really smart cybersecurity experts that care a lot about the healthcare sector. Yeah, a day in the life is certainly growing more gray hairs as it relates to what we're ultimately chosen to protect. I mean, we're talking about life critical assets in a healthcare organization, patient safety, and the trust of communities. And at First Health Advisory, we are digital health risk assurance consultants ultimately. And that means I'm talking to a lot of CFOs, I'm talking to boards, I'm talking to leadership about how we can reduce the probability of material impact to a health system if they're attacked. I mean, that is ultimately what we try to look at and figure out programs of reducing that risk. And the CFO is also looking at that risk, and he's very much a part of this from a financial perspective. We talk a lot about patient safety, we talk a lot about organizational downtime, but a CFO is looking at this most often from a financial and enterprise risk perspective. And they're the ones, in the organization that are trained to look at business risk. And so I'm really excited about this conversation and appreciate being on this panel.
Thanks. It's great to have you. So, Son, let's just start out with you as one who's going hat in hand for budgets. What's the number one objection that you tend to hear when you're trying to get investment in cybersecurity strategy and products? What do you hear back from whoever it be at the C-suite, especially?
So I will start with, I'm very thankful that there is an organizational culture that recognizes the value of information security at Rady. So I would never say there's objections, but there's always a reasonable amount of conversation around what are we doing and why, which I think is fair, right? We're held accountable to the investments we're asking for, and how does that really tie back into the strategic objectives of the organization, right? I won't ever claim to be infallible. And so that's part of the conversation, whether it is requesting capital budget or operating budget. And so the questions are usually around, can we quantify the amount of risk, which is very difficult in this information security realm. And I do try and at least link it to things like, well, we believe it would reduce the amount of downtime or the impact of downtime, right? Those are conversation topics, but we always have to balance it with the economic realities of being a pediatric health system. We're not here for anything other than serving the patients that we do. And so we need to ensure we're balancing the funds that go directly into treating patient care, as well as the things that are ultimately ancillary to that. So I would say the number one question is always, what is this going to do to advance the mission? And since I've joined, I think the value has been communicated fairly well, and folks ask insightful questions. And I've got some great peers that also try and help keep me grounded in case I somehow venture off too deep into CISO land versus how are we moving the program for the IT division, information management division as a whole.
Do you think, this might be a left field question, but do you feel that being a pediatric hospital makes a difference in terms of the moral compass?
I would say so. I've been fortunate to work with quite a few different healthcare organizations throughout my career. And I think there is something special about pediatrics. I think quite a few of us have been in a setting when we were kids where we needed to go to the hospital. I had asthma as a kid, for instance. That's never fun to go to the hospital. And so there is that sense of mission. And then one of the things I do love about Rady is that it really does reflect the communities it serves. It feels like a very, Southern California institution, very San Diego place. And I love that that's seen through in and throughout. And, these are children in your own neighborhood that you might be helping out. So that does go a long way, but it is also a national, internationally recognized institution, and has folks like myself who don't necessarily live in state that want to be a part of the great things that are going on.
Great answer. Shank, you're out there pitching with your teams and bumping into barriers in terms of getting the investment that they need to buy your product. What are some of the number one non-starters that you're hearing from people that are writing checks?
So I think, first of all, I think I will say that healthcare as a whole, I've been doing this for many years. Carter's been doing this for even longer. I think the overall state of healthcare cybersecurity has definitely gone up. Like there's a lot more awareness than it was maybe 5 years ago or even 10 years ago, right? It's increased every year. But even today, I think if you look at and I think it's also the state of the market, if you look at the last couple of years where we have been talking to customers, I think two primary objections that we see. One, which is a little could be shocking for many people, is sometimes boards will say or CFOs will say, but we haven't had a cybersecurity problem. So why do we need to add cybersecurity? And I think, like Sahan mentioned, it is the culture of the organization. Sahan is lucky. Lady Children is a very culturally, they're leaning forward towards cybersecurity. But there are organizations who treat cybersecurity as a cost center. And for them, they see it, why do I need to do it when I haven't had a problem? And if we have a problem, we'll see. And it's a very chicken and egg argument to make. So I think that's number one objection. And then how do you really convince them that when you have a problem, it might be too late, or that water is already, it's already past you. So you have to take action now. So that's number one problem. We haven't seen the problem, so we won't do anything. When we see the problem, we'll think about it. The second objection we hear is really similar to what Sahan mentioned, but it's a slight twist, where people are saying, we already have a few cybersecurity tools. We have a firewall, we have a two-factor authentication, maybe we have some DLP. Why do we need yet another cybersecurity tool? And so I think it goes back to Sahan's point. I think there are organizations who are more culturally adept at explaining how it helps move the ball forward and helps reduce the risk in the organization, how this contributes to the risk reduction, and why the risk reduction is important. And then there are organizations which are not able to do that, and that becomes a big bottleneck. I will say, I think a lot of organizations today are grappling with how good is good enough cybersecurity, right? So at what point do we say that we have achieved a state? And, cybersecurity is hard for sometimes boards to understand, because at what point does cybersecurity become good enough? And because cybersecurity is a moving target, it's really hard to say at this point in time, we're going to be so good that we won't have to do anything. I don't think there's a point like that with cybersecurity. And boards sometimes expect that answer. I do all of this and I won't need to do any more. And that's very hard to quantify in cybersecurity, which makes the problem hard as well.
That's a great answer. And I've done some research on the neuroscience of healthcare IT buying, and that good enough versus best of breed. I mean, there's this natural anxiety of best of breed. Like, why do I need best of breed, and what's the next one down? Is it like from the outlet store? Where do I get the next one down and still get the same thing for a lower price? Carter, I know you have some strong opinions on this, especially.
And I do, and I'd say Sahan is very fortunate to be in an organization where the culture all the way to the top understands why the investment is meaningful to the enterprise and the protection of the patients and the communities that they serve. And then Shankar kind of took a lot of the things that I see for sure. And I'm fortunate to talk to organizations that have all manner of risk appetite, size, budget, mission, business model. And so I see all kinds of different answers to your question about what's the objection. I would say in some form, and I'm seeing less of this, and that's kudos to the awareness, that we're seeing in the marketplace. But the objection I get from a CFO perspective is this is not a revenue generating investment, right? And so how can it be such a priority to an organization that at best might have 2 or 3% margin? How am I going to see the value in this particular investment? And Shankar said it, what is good enough? We call it the Goldilocks zone. And I'm a believer that you could spend way too much on, every tool in the world and not have, good resilience in your organization. And so finding that Goldilocks zone is really important, but also presenting to the leadership and CFOs the value of that investment. It's actually the data is making it a little bit easier, and I know we'll get into that here throughout the discussion. But that risk quantification is so important to a CFO to understand. If I put this many dollars into this particular platform or program, how am I going to reduce risk in this organization, and how do you quantify that?
It's interesting. So, I mean, that goes back to the question: how do you see organizations quantifying that? So, like, what is there a killer metric that even even the doubters and the skeptics could say, "Wow, okay, now that's a data point that I got." Shankar, are you seeing that anywhere? That here's one that tipped the scales.
So I think, look, I think we see a wide variety, like Carter mentioned. There are some very mature organizations because they have quantifiable metrics on how cybersecurity has saved them dollars, saved them. And I can talk more to it, if you have time, on how they actually quantify the ROI. And we included that in our own ROI calculations as well. But a lot of organizations, I think, either have a culture Ready Children's, where they actually just adopt because they understand from a compliance and a cybersecurity need, they just have to do it. But there are many organizations who also do comparative analysis, where they would say, we are, let's say, a 2,000-bed health system. Like what happened when a similar size 2,000-bed health system did not implement the cybersecurity measures? What was the cost from them from a reputational perspective, from a breach perspective, when they effectively faced the problem? And if we had to have a similar problem, what would be the cost for our organization be? That generally also gets the board thinking. Now, the only challenge with that is, if the board does ask you a question, do you give me 100% guarantee if I do all of this, I won't have the problem? And unfortunately, cybersecurity does not come with 100% guarantees. I recently saw an article from, it's not in healthcare, but JP Morgan Chase, obviously is one of the largest banks in the world, saying they have 45 billion attacks a day. Now, I'm sure we don't have 45 billion attacks happening in an organization, but there's a lot of attacks on a daily basis that every organization faces. So, you're trying to make the bar harder and harder for the cyber attacker to get into your organization. It's really moving the risk upwards so that it's harder and harder for somebody to get it. You're never 100% solving it. But that's what organizations are doing. They're comparing it with similar size organizations, looking at the reputational damage, looking at the impact to their organization, and then saying, this is what we believe could be the cost if we didn't do this. And again, I can talk more about some really mature organizations where they got it down to a science, where they're able to say, if I spend here, if I do this, this is what I get as a benefit. This is the ROI. And so I can talk more to that as well. But that's what I would say, very mature to it.
That's very good. Hassan, is there a secret sauce that you have that you saw the light in people's eyes when you were saying here's a magic number?
Yeah, building off of those great points. I mean, not necessarily a magic number, but the base metric, right? If we take our revenue, top line revenue from the previous fiscal year and just divide that by 365, right? Then there's at least that each day of downtime, you could get more granular. Each hour of downtime, to the system, you can at least baseline at that number, right? And that at least gives you a starting point. But also part of that convincing conversation is, without going too deep into the technical, going over, here are the tactics and techniques that threat actors tend to use. Here are where we have some risks in that category. And that is exactly what we do. We try and convince them that if we make these investments or take these steps, sometimes it's soft cost, right? Just updates in process and procedure, whatever we need to change, that will help break that attack path, or at least move it to a more acceptable level of risk, right? And that's, again, going back to that risk management process. If we put our stakeholders in the right position where they are reasonably informed around, here's the risk that we are choosing to accept, here is the risk that we're at right now, and here's that delta, and how do we treat it? Everyone tends to win, and at least you can show that you've done everything to the best of your ability, right? That the mitigation steps are in alignment with the value of whatever it is you're working with. And so I come from a more lean background where I never had a ton of budget. No offense to my old place, I'm sure they do. And so we also try and keep our asks fairly reasonable and really tied to how we, again, moving the program forward on an ongoing longer term basis, rather than ask for, the entire GDP of another country and then, try and negotiate to the GDP of a state. And so that's been kind of my experience, is that we had some big asks up front because at that time, especially, we were in much more of a risk state compared to kind of what was going on in the world. Back in 2020, 2021, there was a lot going on. And now we've moved the needle so much further on our program, building off of, obviously, the great work by my predecessors, that we don't have to ask as much year over year, and it's much more in alignment with, as we continue to mature, as the organization takes on other strategic initiatives or as other risks are unearthed, that we're in a position to tackle those as best as possible.
Interesting. This is sort of a side question. It's only because I serve as a patient advocate. So I'm just wondering if in this process you ever bring patients into the whatever form of insight that you need. I mean, I'm talking about like a direct relationship with patients as cybersecurity relates to them. Is that, Carter, do you?
Yeah, I think it's very meaningful, right? The Health Sector Coordinating Council, the motto coming out of that, and what we're probably going to see here in the next couple of days from Health and Human Services around their cyber performance goals is cyber safety is patient safety. You know, and if the patients are your consumers, and that is the community you serve, if they don't trust the organization that's providing their care or protecting their information, that's a problem. And so we already talked about it. Reputational harm is a massive sort of motivator for leadership to do the right thing. Mm-hmm. I've said, that doing, good cyber hygiene is a business imperative, but I also think it's a moral imperative to protect the patients that you serve. And so absolutely, Frank, I think that's a factor in sort of to piggyback on some of Sahan's comments, around sort of what's moving these decisions. Gosh, one of the things I see a lot of, right, and this is the obvious one, is the organization's attacked. All of a sudden, that organization gets some religion in a way. I'm saying that sort of tongue in cheek. But then you start to see them spend money, which, okay, that's a natural reaction. Another thing that we see that moves decisions at a leadership level is information that's coming out in the national news. And Colonial Pipeline's a great example. It wasn't our sector, but Colonial Pipeline all of a sudden had CEOs asking a lot of questions. Wow, wait, could that happen to our healthcare organization? We could actually go down and lose revenue. And when I'm sitting in the boardroom, and I used to have, all kinds of fancy maps and analytics and on this question, and now when I get asked the question, well, what if we don't invest in this program? And I, pretty simply say, well, how long can you go without generating revenue? If your services are non-operational, you're losing money every day. And Sahan, referenced that. That's a great way to get the attention of a CFO, and historically, it's been so subjective. The risk that we tell them when we have these heat maps and it's high, medium, and low, that doesn't move a CFO. What moves a CFO is financial risk exposure, right? And what's the cost of a breach? Those are
then it becomes almost then it almost becomes a revenue center, as you were saying before, that just by the subtractive effect of it.
Unequivocally, right? Then you think about, civil penalties, you think about class action lawsuits, and you add all of that up and you put that in front of a CFO, that CFO goes, well, maybe this isn't such a risky investment of my dollars. That's the takeaway.
So just hitchhiking on that, Shankar, I mean, you're scientists, your algorithmic people have developed the total cost of ownership tool in the organization there. I'm wondering if you could tell us about how that formulated and what some of the insights that you get from that tool and what the insights that potential buyers, I would imagine it's agnostic, right? It's not.
So I think this goes back to the point that Sahan and Carter had mentioned, right? So I think a lot of times over the last couple of years, we have seen that, cybersecurity is seen as a cost, right? And so you have to make the claim that, this actually will block your services, reduce your services, but we still run into this barrier where people will say, but it has not happened to me so far. So why should I think I'd spend now? Why don't I spend it a year later? So it's a question of now versus 2 years or 5 years or 3 years. And you don't know what that time zone is. So we said, what do we do? But we have some very mature organizations who are doing it differently. So we said, what are they doing differently compared to the rest? And what they did is, and which is what I'll talk about, but they flipped the problem and they said, what if we don't treat this as a cost problem, but as a revenue generation problem, as a revenue generation thing? And so we asked them, how did they make the case to the CFO that this is a revenue generation aspect? And so the way they did it, which is what our calculator then tries to model, which is what they did it in their side, is it takes every area. So from an inventory perspective, the first thing you have to realize is many hospitals, and I know how it is at Rady Children's, Sahan, I don't know, but many organizations don't quite know all their devices, and sometimes they have nurses hiding these infusion pumps in these closets. I mean, I love nurses. We have friends who are nurses, but they do hide it. There are imaging devices that are being held on by some departments because they might need it anytime. And so what happens is it creates an incorrect understanding of what is your inventory, leading to buying new devices that are not required at the time. And then when you couple that with utilization data, getting good inventory, getting good utilization, when you combine them together, you actually have some sense of ROI that if I had this kind of data, if I had a better understanding, I could have certain amount of saving on my capital purchases by implementing this. So that's the first aspect of ROI, that I can actually save on capital equipment by buying a solution or implementing a program. The second aspect is on vulnerability management. I think when we realize that when we talk about vulnerability management from a threat and proactive perspective, a lot of CFOs shut down and they said, yes, this is all great, but again, it's not my problem. This is the cybersecurity. I gave that person a budget of $500,000 3 years ago. What has they done with it? And this goes into this quagmire. Whereas if we turn the problem around and we said, look, you have a lot of legacy equipment. You have many of them left with like 10 years in your support life. But if I can tell you that only like 10% of them are really at risk, and here is where your risk lies, and here's how you mitigate it, and this is what you need to replace, you can effectively turn around the entire problem and say, what percentage of it am I saving by implementing and monitoring this? And what can I actually save by implementing very targeted measures when I don't have a patch or micro segment? That is my capital saving. So again, it provides an ROI. Rather than a cost-based discussion, it's an ROI-based discussion where you're actually saving money by implementing a program, a solution, or whatever it might be. And then the third piece is on, on data capture alone. Like there is a lot of data capture. Sometimes, devices don't communicate to the EHR. They don't communicate to the EMR. There is loss every day that you actually have to manually capture the data, walk in, and people do this. They take in hard disk, they walk to the EMR, they plug it in, they transfer the data. But what if you can actually debug the problem, save you maybe 10 hours worth of man hours in doing that on a day-to-day, and then there might be other implications future. So again, there's an ROI there in actually having that ability to do it instantaneously at the problem and moving it forward. So all of that is what we are capturing in our risk modeling tool and some other aspects, which then changes the conversation from a cost-based perspective to an ROI-based perspective, which then allows the CFO to say, this is the cost I'm incurring today. This is where I'm hiring extra people. This is where I'm hiring extra time. And I could better utilize my time, better utilize my resources if I implemented this program. And that now becomes an easier discussion, something I can get their head around. And cybersecurity is no longer a cost, but really an ROI. On top of it, obviously, it has other benefits as well, like has been.
Carter, have you used tools like this?
Yeah, absolutely. All right. And I don't want to turn this conversation into an AI conversation, but to piggyback on Shankar's messaging and what his organization does really well is also sort of get at automating things that were typically manual and very labor intensive. And so as CFO, they want to see those types of use cases where the platforms and tools like Assembly are beginning to automate processes for better decision making. And so that's something I see a lot. I also believe we're sort of moving into an era, if you will, of accountability. And we'll have to watch, some of the movement, from Congress, but we're seeing agency-specific activities, SEC, for example, where they're saying public companies and the officers that make these decisions to invest in cybersecurity or not invest are going to be held accountable for those decisions. And that's starting to get the attention of CFOs, CEOs, and boards of these organizations. Might that move into a not-for-profit status? That's a big element in healthcare, but I think we're moving into a new era, if you will, of accountability, where you're going to really start to see boards and CFOs and CEOs pay a lot closer attention to the conversation we're having today. And so I'm just watching that really, really closely.
I would think so. Sahan?
Oh, not too much to add. I'm all for more accountability, right? And I agree that those, it's the same way where there are certain decisions where it's not that I'm punting, it's that I don't think I'm the appropriate person to be making this decision from a risk standpoint. And so that level of nuance, I think, is part of where you hopefully have strong security leadership that understands how to make sure that risk is being accepted by the right levels of the organization.
Yeah, I think that security leadership is the key word there. Shankar, you had mentioned the spending additional money on workforce. How do you see the balance of technology, advanced technology, in a world of having a hard time in the workforce getting enough cybersecurity people, if that's the world that we're all living in? I don't know. Can technology make up for reductions in security workforce?
Yeah, I think
how much we need the human.
Yeah, so I think you still need the human. I'll start with that. I think people talk about generative AI, and there's a lot of talk now all around us on how it's going to replace all the jobs in the world, and then it's all going to be machine driven. I think the best systems are a combination of humans and technology. And I think processes and people are as important as the technology itself. I'll definitely start with that. You can never get rid of anything, otherwise in a health system, if you have a technology that automatically shuts down systems, then you're going to have a big problem, because that system could be right in the operating theater where a patient is getting treated, right? So I think that's where humans come in. But technology can go a long way in elevating some of the human concerns. And I speak about a couple of areas, right? Like, let's take visibility. Like, how would you actually go and classify and mark every device in your environment manually? It's just really going to be a lot of time and effort put in, and that's going to drift over time. So you're going to be back to square one in 6 months, and you spend all this effort doing. Look at vulnerability management. Every day, there are thousands of vulnerabilities published. And so if you're going to manually match them, manually prioritize them, manually figure out, and even if you use some basic matching, and then you do all the prioritization in hand, and then you figure out the microsegmentation in hand, it's just massive amount of work. And when you can't microsegment, what is the alternative? So there's a massive amount of work that can be automated by a solution. If you look at monitoring, you can't even monitor. How do you do data capture? We have organizations which do data capture manually. They go in and they will capture data. They have a long process. It takes 2 weeks. They don't really get anything meaningful. And then they have spent like literally 40 manas, like just trying to get data out of the system. So there is a lot of work that a solution can do that can totally automate many of the elements that will just take many, many hours. And in some cases, frankly, impossible to do. But you do need some human element to it. You need processes in place. And I think for the mass shortage problem, technology will solve some of it. And then there are other service organizations, I mean, Firsthelp being one of them, that can come in and actually help augment that as well. So I think there is a solution for the problem. It's some element of it is technology, some like the solution that Assembly provides, some element of it is additional services, something like what Firsthelp will provide. And when you combine them with a very mature organization, then I think you get a total package that can actually elevate the problem from a resources perspective.
Great answer. So how would you describe the workforce but to technology landscape in your organization? What are the challenges of cybersecurity workforce where you work?
Absolutely. I'm a little bit of a traditionalist. I like the people, process, tools pyramid, and people are at the foundation of that pyramid. That's a lesson I think most folks who move into leadership learn at some point, is that you can get a whole bunch of tools, and if you don't have the right folks or the right amount of folks that are able to leverage them, then you are going back to the ROI conversation, lowering the return on that investment. And so there is that balance. And I think in healthcare, that's one of the struggles, is that we're very conscious of the resources that we have available. And the cost of staffing is one of the hardest ones to reactively handle, right? And so you're very intentional about increasing staffing. And again, the priority is staffing towards patient care. And so we ask a lot. We try and make sure that we're constantly investing both in the folks on the InfoSec team as well as the people in the broader context. And so I don't know how necessarily unique this is, but I'm proud of a lot of the things that we do around training for, especially folks within the information management division and the broader Rady community. We do town halls, we do internal webinars, we do training. I host things like Fire Talks, where I try and go over security concepts, as well as inviting other teams to present their items, because we really look at it as a much more holistic point of view We always like metaphors, and we don't want to just look at, well, here's just the nervous system and everything related to the nervous system, all the things that feeds into and receives what's from, right? And so for looking at more preventative types of risk management, if we can make sure that, for instance, our server team is much more equipped in understanding, here are the things that InfoSec cares about, not just like a checklist, not just here's a KB article on how to create a more secure service account, but understanding the why behind the what, they're less likely to make some sort of error in judgment when they're going around doing their daily duties, right? They're not going to necessarily give some service account administrator privileges on a server without checking with InfoSec, right? And items like that go a long way. We like to talk about things that are going on from a more macro standpoint, current events, again, what are threat actors doing from a tactics, techniques, and procedures standpoint, and trying to give as much transparency as we can around what are we doing on the InfoSec side, right? Here are things that we're doing around our detection pipeline, and here's why this policy is written that way, and what is NIST cybersecurity framework or other things like that. But it is hard out there to attract talent, and we're fortunate we have really kind of a workforce of the future mentality, and so we hire folks from all over the United States. That helps reduce that barrier to entry. But if you need someone in San Diego, it is a little bit tougher. Sometimes you need people in the San Diego area, right? If something bad happens, someone needs to be there, and so you have to take into account then the other incentives that are in people's lives, like cost of living
and great weather out there. So Carter, you and I have talked about this ad nauseam many times about technology can cause burnout, and technology can solve burnout to a certain extent. So, we see the burnout in the security segment, CISOs, and largely because
bags under my eyes today.
as Han was saying, that we got to have them here in San Diego, and it's not just like 9 to 5, Monday to Friday. The problem doesn't go away on the weekends or bank holidays. So what? Where are you seeing the convergence of workforce, burnout, technology, all of this stuff coming together?
Yeah, that's a weighty question for sure. A couple comments on workforce. Number one, this is one of the primary pillars, of advocacy, here in Washington, D.C., from a congressional standpoint, is how can we incentivize a younger generation to come into the field of cybersecurity versus wanting to be an influencer on TikTok, right? We need to make it a little bit sexier, if you will, to be in this field. The second piece, and Sahan talked about it, is in healthcare, the talent pool is slim, and especially when you're competing against other sectors like the financial sector that oftentimes can offer higher salaries for talented individuals. So that's something that I think we're going to be talking about for a long time, but I'd love to see something from Congress in the workforce arena to incentivize, and there's a lot of ideas around that. The other piece that I think is really sort of human sort of intensive is governance, and we should see the NIST Cybersecurity Framework 2.0 final rules come out where they've added governance, but that's an element that's been largely missing from cybersecurity programs in healthcare. And so governance is such an important element that we could probably have an entire panel discussion on. And I know there will be at the upcoming VIVE conference, but that comes to mind when you talk about workforce. The burnout element is so real, and it's not just cyber, it's IT in general, it's clinicians, it's healthcare as a whole. We've been through so much in the last 5 years, and there's, from a cyber perspective, this feeling that we're always losing. We're continually being attacked. There's nothing we can do about it, and it does eventually create real, honest to goodness burnout. And so, in our organization, we're very conscious of that burnout. We really try to promote, time off policies and more progressive approaches to having people step down from the day-to-day, what I call grinding of being in cybersecurity. You have to pay attention to it. And you see it, you know, from a CISO perspective, a cyber leader perspective, or any level, there's absolutely burnout. And if you don't pay attention to that as a leader, you're going to lose people. There's going to be a lot of attrition as a result. So that's a really important issue.
Right. Shankar, we're reaching our time limit here, but I'd like you to have closing comments here. And if you could throw in the part about the moment. I'm a moment person, not because I'm that zen. I just think that there's not enough metrics at the moment in healthcare, especially as it relates to patient experience, and surely now in cybersecurity. So closing comments for the audience.
No, I would say, I mean, I think I've mentioned this before. You know, a lot of people who look at cybersecurity look at it as we have to solve all or nothing problem. Oh, I got to get all of it solved, and this is what I have to present to the board. Cybersecurity is such a vast area. We are only scratching the surface when we do certain things. So think of it as not eating cybersecurity as a whole, but eating small chunks at a time. And you got to make small steps of progress to actually reach your eventual goal. And so when you look at cybersecurity, and the topic of this panel is when you look at it from a budget perspective, try and not present this, I need, like Sahan mentioned, the GDP of a country to solve the problem, but I need little chunks to actually make progress. And this is how it's going to make progress by. And I'll add a line for assembly. Assembly helps you get there. And I know First Health helps you get there. Carter, for line for you as well. But I would say from your perspective, from the CISO, from the cybersecurity, like Sahan mentioned, directing the initiative and efforts to what is the next thing I need to do to make the next level of progress, and then breaking it into little chunks. I think that's the way to go, rather than trying to solve 100 things at a time and not getting anywhere and asking for maybe a $50 million. I think that's not how healthcare flies. That might work in financials, but that's not going to work in healthcare. So making smaller steps, incrementally showing the progress, I think that's the way to go in healthcare.
Great panel. I'd like to thank you all. Just a closing comment that Carol will be posting a discount for the Vive conference that we're doing as a joint venture with Chime and Vive. So you'll get a discount to that. Also, I'd like to put in a plug for a new radio program called Health Stealth Radio. And one of our first guests is one Carter Groom, the Baldrige Award winner, down in the bottom left of my screen here. So please tune in to Health Stealth Radio when you can. So thank you all for your time. Thank you for your patience of watching me 3 times today. And I look forward to having another session with you sometime soon. Thank you, gentlemen.
Thank you all.
Frank.
That was terrific. Appreciate it.